Imagine hearing a voice that knows something your doctor does not. Not a vague feeling, not a nightmare, not a dramatic whisper from a horror movie. A clear voice, calm enough to be trusted, specific enough to be terrifying, telling a woman in London that something was wrong inside her head. Most people would do exactly what she did. They would panic. They would wonder if their mind had finally turned against them. And they would go to a doctor, hoping to hear the one sentence that makes everything normal again. There is nothing physically wrong with you. But that is not what happened to the woman known in the medical record only as patient AB. Her case was published in the British Medical Journal in 1997 by psychiatrist Dr. Azuonye, under a title that still sounds impossible, *Diagnosis Made by Hallucinatory Voices. And the deeper you look at it, the more uncomfortable it gets. Because this was not a story about a person hearing random voices. The voices gave information, they gave direction, they pushed for a brain scan. And when doctors finally looked, the scan found a tumor. So the question is not only how did she hear voices, the question is worse. How did the voices know? The case begins in 1984. AB was a middle-aged woman living in London. She was not presented as someone with a long psychiatric history. She was not described as a drug user. She was not walking around chasing visions or building a fantasy around herself. She was living a normal life. Then the voices began. They identified themselves as two people connected to Great Ormond Street Hospital. That detail alone was strange enough, but they did not arrive with the usual grandiose nonsense that appears in many dramatic stories. They did not tell her she was chosen. They did not demand worship. They did not offer prophecy. They said they wanted to help. That is what makes the case so unnerving. The voices behaved less like chaos, and more like a team with a job. They gave her information she did not believe she had. Some of it, according to the case report, was later checked and seemed accurate. But instead of comforting her, it frightened her even more. Because if a voice inside your head tells you something false, maybe you can dismiss it. If it tells you something true, your world gets smaller. AB did what a rational person would do. She sought medical help. From the outside, the situation looked obvious. A woman was hearing voices. She was frightened. She believed they were communicating with her. A psychiatrist was brought in. Dr. Azuonye diagnosed her with a functional hallucinatory psychosis and prescribed thiouridazine, an antipsychotic used at the time. And for a moment, the story seemed to return to familiar ground. The voices stopped. AB was relieved. Not a little relieved. Deeply relieved. She believed she had recovered her sanity. She even went on holiday. That detail matters, because if she had been secretly trying to manipulate the system, if she had invented the whole thing for attention, the disappearance of the voices should not have felt like freedom. But it did. Then, while she was abroad and still taking the medication, the voices came back. This time, the tone was urgent. They told her to return to England because something required immediate treatment. Now the trap closed around her. If she ignored the voices, she could be ignoring a warning. If she obeyed them, she could be walking deeper into madness. This is the part of the story where most people like to pretend they would be calm and logical. They would not. Nobody wants to be the person saying, "A voice told me where to go." But the voices gave her a location. They directed her to a specific address. Her husband, trying to reassure her that it was all in her mind, took her there. The address turned out to be the computerized tomography department of a London hospital. A CT department. Not a chapel. Not a random building. Not a symbolic place. A department that could scan the inside of her head. When she arrived, the voices told her what to ask for. They said she had a brain tumor and inflammation near the brainstem. AB went back to Dr. Azuonye in distress. Now imagine being the doctor. A patient tells you voices are giving her medical instructions. You examine her, and you do not find obvious neurological signs pointing to a brain tumor. You know brain scans are expensive. You know colleagues may think you have gone too far. And yet the patient is in front of you, terrified, persistent, and strangely coherent. So Dr. Azuonye requested the scan. Even that was not simple. The request was initially resisted because there was no strong clinical justification. In plain English, the medical system did not want to scan a woman just because her voices said so. That is the rational response. It is also the part of the story that almost buried the truth. Eventually, after negotiation, the scan was done. The first scan led to another scan with enhancement. And then the image showed what nobody expected: a meningioma. A mass in the brain described in the medical report as a left posterior frontal parafalcine tumor, extending through the falx toward the right side. Not exactly where sensational retellings sometimes place it. Not neatly packaged like a movie. But real. There was a tumor. And until the voices forced the issue, there had been no clear physical signs strong enough to make the doctors chase it. That is the knife edge of this case. The voices were clinically wrong in some details, or at least imprecise. But they were right where it mattered most. There was something in her brain that needed attention. The neurosurgeon discussed the options with AB and her husband. They could wait for symptoms, or they could operate. They chose surgery. According to the report, the tumor was removed completely. Then came the farewell. As AB recovered after the operation, the voices returned one last time. They said they were pleased to have helped. Then they were gone. No dramatic sequel. No second mission. No new prophecy. Gone. The antipsychotic medication was stopped after the operation, and the voices did not return. That final detail is what keeps this case alive, because it leaves everyone with an explanation that feels incomplete. Maybe the tumor affected the brain in a subtle way, creating sensations AB could not consciously understand. Maybe her mind translated those signals into voices because a voice is harder to ignore than a headache, especially when there is no headache. Maybe the brain has emergency systems we barely understand. Ancient, ruthless, built for survival, able to turn hidden body signals into a command. Or maybe something stranger happened. Not necessarily supernatural in the cheap sense. Not a ghost knocking over furniture. Something more disturbing. Information crossing a boundary. We do not yet know how to measure. The skeptics had their own theories. Some wondered whether AB had known about the diagnosis before and built the story around it. But Dr. Azuonye argued against that. She had lived in Britain for years and was entitled to treatment. She had also been relieved when the voices first disappeared, which does not fit cleanly with a person trying to keep a story alive. Others suggested she must have felt something physically, even if doctors could not detect it. That explanation sounds sensible, but it still does not explain the address. It does not explain the timing. It does not explain why the voices stopped after the tumor was removed. And it does not explain why this case feels less like random hallucination and more like a warning system with a personality. That is why patient AB's story refuses to die. It sits in the uncomfortable space between medicine and mystery. Not proof of angels. Not proof of psychic powers. But a documented case where the neat categories failed. The doctor expected psychosis. The scan revealed a tumor. The voices vanished after surgery. And the woman went back to her life. The most terrifying part is not that AB heard voices. The terrifying part is that ignoring them might have been the more dangerous choice. So what was this? A brain saving itself by creating an internal messenger? A coincidence wrapped in medical drama? Or a glimpse of something about consciousness that we are still too early to understand? Whatever the answer is, patient AB forces one brutal question onto the table. If your own mind knew something before you did, would you recognize the warning? Or would you silence the only voice trying to keep you alive?